Good day, everyone. My name is Owen Seats. I'm the Clinical Coordinator of Respiratory Care Services at St. Alphonsus Regional Medical Center. I'm going to talk to you today about oxygen safety. So today's objectives are have a good time learning about oxygen devices, learn the differences between high and low flow oxygen systems, learn the limits and safe application of the featured oxygen devices we'll talk about today, review scenarios for safe application of oxygen and delivery devices here at St. Alphonsus. First things to consider, oxygen is considered a drug. Therefore, we need a physician's order. The application emergency circumstances will cover us, but at the end of the day, we do need to make sure that we have a sufficient order. It covers us in the application of oxygen. If we were to bill for oxygen and we don't have an order, in most respects, this is considered fraudulent, and we want to avoid this. So we need to remind ourselves after the storm has gone away that we need to get an order for the oxygen that we've applied on the patient. It doesn't mean that we don't treat the patient, but we do need to be considerate and obtain an order. There are 4 factors that affect oxygen delivery when we're dealing with nasal cannula and mask devices: depth of respiration, respiratory rate, the seal of the mask, and the flow rate of the oxygen being delivered either via the cannula or by the mask. I'd now like to talk about low flow oxygen systems. A low flow system is considered a device that only provides part of the patient's inspired gas. Common low flow systems are nasal cannulas and simple masks. Often the question comes up, well, what is the hardest flow to maintain? The story goes, and this is my boss who is a son of the South, and this is where I've learned that a good story and ponderance are important things when you're working with folks. So we were sitting around the RT department and we're considering what is the hardest flow to maintain. My boss walks in, Gordon. We ask him, hey, Gordon, what's the hardest flow to maintain? So Gordon ponders for a little bit, and he gives us his answer. And he tells me, why, Owen, a linoleum flow is the hardest flow to maintain. When using low flow oxygen systems, especially a nasal cannula, we need to keep into consideration the limits of the device, and this is 1 to 5 liters per minute. Often people ask me what percentage does the cannula deliver, and there's an estimate out there at about 4% per liter is an approximate percentage of the oxygen. However, what is actually delivered is based on depth of respiration, frequency of breath. We do use a specialized plastic which decreases the risk of skin breakdown with our nasal cannulas here at St. Alphonsus. Another consideration is when to use a bubble humidifier, and I'm asked this a lot by my nursing friends. A bubble humidifier is not the most efficient humidification system because it doesn't have a heat source. So it's going to be based on the heat of the room is going to be its heat source. Generally speaking, we like to put a bubble humidifier in patients that are at least 5 liters per minute or greater. What we cannot do is use a bubble humidifier with a mask device. This creates too much back pressure and causes erroneous levels of O2 to be delivered to the patient. They are only really utilized in patients who are on nasal cannulas. So the takeaway here is if you're using a bubble bottle, you can only use it with a nasal cannula. Another low flow oxygen system we use extensively throughout the hospital is a simple mask. With the simple mask, we can use between 6 to 10 liters per minute of flow. But we can never go less than 6 liters per minute. When we go less than 6 liters per minute, there can be a rise in CO2 in the mask itself, and the patient can rebreathe this, which could be detrimental to the patient. Often I'm asked, what is the FiO2 delivered by a simple mask? Well, this is variable based on depth of respiration, frequency of the patient's breathing pattern, and the seal of the classic one-size-fits-no-one mask. We can estimate between the liter flow that a simple mask can deliver between 35 and 50% inspired oxygen. But again, there are variables that will affect the mask performance. High flow oxygen systems. High flow oxygen systems either meet or exceed the patient's demand for inspired gas. They can provide oxygen at a constant and preset concentration. And they can be rather invasive in their approach of delivery. So I'm about to show you some invasive high flows. Right? Each one is a little generational, but flow in the middle is the most recent that we tend to focus on. The non-rebreather mask is a workhorse of the hospital. It can be used in emergent situations. There should be consideration, though, if we're going to use it long term, to maybe move to a different high flow system, and I'll talk about that here in a few minutes. The non-rebreather should be set at 10 liters or higher. If it's less than 10 liters, we don't get sufficient clearing of CO2 in the mask, and that can be detrimental to the patient. You do want to provide enough flow to the system to keep the bag that hangs from the bottom of the mask inflated during inspiration. The estimated FiO2 range, and again, this is based on seal of the mask, flow to the device, depth of respiration, and patient's frequency of respiration, can be anywhere from 80 to 100%. These masks have a very immediate drying effect on the patient's airways, and if we're going to utilize these for long periods of time, we should take into consideration possibly using high flow systems to provide better humidity. These are generally used in acute situations where we can wean down quickly and not have to use it extensively. Nice little picture here of our mucociliary transport system. We want to keep this in balance, and again, that high utilization but long-term use of the non-rebreather mask can dry out the mucociliary transport system. You and I have an intact system, but where it really impacts patients, and we need to be mindful of this, is those patients who have pulmonary disease. They may have a mucociliary transport system that might not be in the best of shape. And so if we put them on a drying mask for a long period of time, we really can set them back clinically. The immersion of a humidified high flow oxygen system has been in effect for about 15 years now. And with these systems, you can provide a wide range of FiO2 that's fixed, so we know absolutely what the FiO2 is, but provide nicely humidified gas so we keep the airway lumen warm and humidified. This serves a wide range of patients, and we put it into consideration a lot for folks that might not be acutely critical, but so folks that need long-term humidified oxygen support. So you see a lot of these used on the floors throughout the hospital here at St. Alphonsus. Application scenarios. Sometimes we want to think outside the box, and it might not be best for the patient. So here are a few application scenarios that we've run into. When using a bubble bottle, we need to match plastic threads with plastic threads. In this case, they must have not had the top piece that attaches here. So what they decided to do was put a nipple adapter in the top of it. This creates a leak. And so the liter flow that they put the patient on didn't exactly reach the patient. And so we had to do a few adjustments, like get rid of this thing and actually put the proper bubble humidifier on the patient. Another device that tends to show up is the spare part of a non-rebreather mask. These are often considered another nipple adapter, but cannot be properly utilized because they do not have a threaded adapter that threads onto this metal thread right here. This too can create a leak, and the oxygen flow you want to deliver to the patient will not be sufficient or accurate. This is what I like to call the room air challenge. Notice to the left we have an oxygen flow meter, and to the right we have an air flow meter, and by coloration that tells us the difference. Green is for oxygen, yellow is for air. Often when we're not being mindful, we're moving along, we can make a mistake and accidentally hook the patient up to the wrong flow meter. This has been a case for a long period of time, and we've always had issues with this. So often you'll see hard stop warnings to remind you that you shouldn't connect O2 devices to airflow meters. But often there's still drift, and we still see injury to patients. So at St. Alphonsus, what we elected to do was to remove all the airflow meters from service, since the RT department was the primary user of the airflow meter. And our situation with patients being connected to the wrong flow meter has gone down drastically. So it again is a win for patient safety. So like anything, we have standards, and there are standards that we need to use when we're applying oxygen devices in the hospital. We need to be aware of the limitations of the devices, and we need to be aware of the application. If we're going to use, for example, a non-rebreather for an extensive period of time, we need to consider the airway lumen needs to be warm and humidified. So switching them over to a high flow device is relatively easy and convenient, especially at our hospital where we have a sufficient number of devices. Matching threads to threads and not turning equipment into something that it wasn't intended for by punching holes in it, or using accessory pieces that weren't meant for the true application of what should be used. These all tend to create situations when we don't observe them that cause harm to our patients. And nobody here in this room wants to cause harm to their patient. There is a standard out there that we're all used to, and this is why I have the highway sign, and this is my final thoughts on the matter of systems of safety or systems that allow us to function safely. The US and US 95, and that's a freeway that runs through Idaho, stands for, and many people think it stands for actually the United States, US 95. US actually stands for Uniform System of Highways. Just like a uniform system of highway, we have a uniform system of how devices should be applied and work within the hospital. In the uniform system of highways, highways that have an even number run east and west, and highways that have an odd number run north and south. So just like the system of highways that gets us where we want to go, we need to make sure that we follow the safety checks that are in place to deliver proper oxygen to our patients within the hospital. I want to thank you for your time today. God bless all of you, and thank you for choosing St. Alphonsus as your employer.